In this podcast episode, Gary Brecka interviews Dr. Paul Saladino, a double-board certified physician with a background in cardiology and psychiatry. Dr. Saladino embarked on a health journey after struggling with eczema, asthma, and allergies as a child. His exploration of nutrition led him to experiment with various diets, including a raw vegan diet, which ultimately proved detrimental to his health. This experience, coupled with his research, led him to adopt and advocate for the carnivore diet. Initially, Dr. Saladino adhered strictly to a meat-only diet, but over time, he adjusted his approach to include moderate intake of carbohydrates from fruits. He emphasizes the importance of flexibility and individualized approaches to diet, acknowledging that what works for one person may not work for another. Dr. Saladino's experience in Western medicine, particularly in psychiatry, revealed a disconnect between the treatment of mental illness and the consideration of diet as a potential factor. He observed the prevalence of neuroinflammation as a root cause of psychiatric conditions and the lack of emphasis on dietary interventions in mainstream psychiatry. This realization led him to explore the role of nutrition, particularly an animal-based diet, in addressing chronic illnesses and autoimmune conditions. Drawing from his interactions with hunter-gatherer tribes and anthropological research, Dr. Saladino proposes a hierarchy of nutritional value in unprocessed animal and plant foods. He challenges the conventional belief that plants are superior to meat, emphasizing the preference for meat, organs, honey, and fruit among hunter-gatherer communities. By questioning assumptions about nutrition and considering the evolutionary context of human diets, Dr. Saladino advocates for a balanced approach that prioritizes nutrient-dense animal foods while acknowledging the potential benefits of incorporating plant foods for some individuals. Dr. Saladino discusses the use of ketogenic diets in treating drug-resistant mental illnesses, highlighting the role of nutrition in addressing neuroinflammation and psychiatric conditions. He underscores the importance of considering dietary interventions in mental health treatment, citing examples of successful outcomes with ketogenic diets in managing severe forms of schizophrenia. This perspective challenges the traditional approach in psychiatry and emphasizes the interconnectedness of physical and mental health through dietary interventions. Dr. Saladino critiques the limitations of Western medicine in addressing the root causes of chronic illnesses and autoimmune conditions. He highlights the lack of emphasis on diet as a therapeutic intervention in mainstream medical practices, particularly in the treatment of conditions like inflammatory bowel diseases and cancer. By sharing anecdotes of individuals who have experienced improvements in their health by eliminating plant foods, Dr. Saladino challenges the reliance on randomized clinical trials as the sole basis for evaluating the efficacy of dietary interventions. Dr. Saladino explains that cutting out carbohydrates, especially ultra-processed ones, can lead to improvements in diet quality. He highlights the difference between natural sources of sugar, such as fruits and honey, and processed sugar, like table sugar. Natural sources of sugar come with additional beneficial compounds that help prevent bacterial overgrowth in the gut, unlike processed sugar, which can lead to inflammation and other health issues. Seed oils, such as canola, sunflower, and soybean oil, are highly processed and contain high amounts of linoleic acid. Dr. Saladino warns against consuming excessive amounts of linoleic acid, as it can accumulate in the body and lead to cardiovascular issues. He explains that seed oils are not part of our evolutionary diet and should be avoided in favor of healthier fats like tallow and butter. Dr. Saladino cites historical data from 120 to 130 years ago when Americans primarily consumed animal fats and had lower rates of cardiovascular disease. He mentions the shift in dietary recommendations in the 1950s, influenced by the funding from companies producing seed oils, leading to the demonization of saturated fats and promotion of polyunsaturated fats. To reduce the intake of linoleic acid, Dr. Saladino recommends avoiding seed oils and opting for grass-fed beef and naturally raised poultry. He explains that ruminant animals can convert polyunsaturated fats to monounsaturated fats, making their meat a healthier choice. Additionally, he advises against consuming flaxseed oil and emphasizes the importance of monitoring linoleic acid levels in the diet to prevent cardiovascular issues. Dr. Saladino challenges the traditional view that high levels of LDL cholesterol are directly linked to atherosclerosis. He argues that the relationship between apolipoprotein B and atherosclerosis is more complex, especially in individuals with metabolic dysfunction. He points out that centenarians with elevated LDL cholesterol levels do not necessarily develop atherosclerosis, suggesting that other factors, such as endothelial damage and oxidation, play a significant role in cardiovascular health. Dr. Saladino discusses the challenges in the medical community regarding the adoption of dietary and lifestyle changes for managing chronic diseases. He mentions the difficulty in undoing established beliefs and the tribal nature of medical professionals. He also points out the influence of conflicts of interest in shaping dietary guidelines and policies. Dr. Saladino advocates for making small changes towards a healthier diet, emphasizing the concept of lateral shifts. He encourages individuals to focus on consuming whole plant and animal foods, gradually reducing the intake of ultra-processed foods and seed oils. He stresses the importance of progression over perfection and not letting perfect be the enemy of good. To Dr. Saladino, being an ultimate human means embracing one's birthright to vitality and optimal health. He believes that humans have the potential to be incredibly vital and capable when living in alignment with their evolutionary history. Being an ultimate human involves returning to a state of normalcy where feeling amazing is the baseline rather than an exception.